And welcome back to Open Line as we continue our conversation with Dr. David Aronoff from Vanderbilt University Medical Center about COVID-19. And I'm looking at our Facebook page, lots of folks on there watching as well. There are lots of concerns with schools, and we did have that one caller who was asking about that. The safety of students, is it safe to go back to school? I mean, there's a lot. You said you're a parent. There's got to be a lot to juggle here when you're thinking about what's best for your family.
Yeah, no question about that. I think that, again, this is a moving situation. Once COVID-19 arrived in Tennessee in early March, we were already thinking a lot about school, and students eventually, as we know, got sent home. And it may be that educating at home needs to be part of the new reality in the fall for some students. It may be that some schools have to have a staggered schedule where a portion of the student body is there on Monday, Wednesday, and Friday, and another portion is there Tuesday, Thursday. There may be more creative things that need to be done to keep population density lower in school buildings, to keep people safe. If disease activity continues to rise the way it is, we may see the beginning of the school year changed in some way, whether that's starting online or delaying the beginning of the calendar year. So I think right now we don't really know what that school year is going to look like in the fall, despite I think everybody's intent on having some sort of normal student-teacher experience come the fall.
And along with school, of course, we're starting to look ahead to school sports, high school football. The TSSAA coming out today saying that the start of football season will be delayed. Do you think it would be safe to be playing football right now?
Well, I think, again, what we know is that COVID-19 generally does not adversely affect people under the age of 20. Children tend to do okay with this, and some don't get symptomatic at all. But the more children who get infected, the more likely it is that a few of them are going to get very, very sick. And I know from my colleagues in the city of New York that had a massive outbreak, as we know, that there were lots of children in the hospital. Some died and some were really critically ill. And granted, that was a small fraction of the total number of children who got infected, but it's a possibility. It's just less likely than for adults. So we do have to remember that the last thing we'd want to see is a child get critically ill with COVID-19. The other thing that we need to remember is that to put on organized sports, even if fans are not in the stands, requires adults to be umpires or referees or line judges or scorekeepers or coaches or facility operators, the people that turn the lights on, the people that maintain the facility. And again, if those adults who are engaged in these activities are in high risk groups, maybe they have high blood pressure or diabetes, or they're over the age of 60, and even without risk factors at all, they could still get very, very sick with COVID-19. So as much as it would be great to be able to have organized sports back right now, even, I think we realistically need to understand that this pandemic is still actually heating up in the state, particularly as people have been getting back together again. And that may be telling us that we need to slow down and do the things that we have to do to protect our population from getting sick from COVID-19.
I'm going to go back to the phones here. We've got another caller on the line. Jeannie, you are live on Open Line. Go ahead. Can you hear us, Jeannie? Are you there?
Hi, thank you.
Yeah, go ahead.
Here is my... Yes, can you hear me?
Yes, go ahead. We've got you.
Oh. Can you hear me?
Yes.
Oh, good, good. Okay, I'm out in the boonies. All right, I'm talking about the hot spots that you mentioned.
Okay, go ahead.
Yes, talking about the hot spots that you mentioned. And I'm thinking hot spots like jails, nursing homes, and a lot of Hello?
Yeah, we've got you. I think if you could mute your TV, that might be throwing you off there.
All right.
Try that and see if we can.
Okay, you ready?
Yeah, go ahead.
I'm sorry.
No, it's okay.
Yes. I'm interested in these hot spots that you were talking about, places that are crowded like jails and nursing homes and other areas. Now, I noticed that the low-income areas in the nursing homes and jails all get access to free flu shots and yearly. And I just had a simple question. Do flu shots, is there any kind of cross-reference or data showing people that were, positive for corona, were they recipients of these, these yearly flu shots in these hot spots where they can get them free and things like this? It's a simple question, but nobody can seem to say that there is such data. Thank you. Sorry for the delay.
No worries. Thank you for calling. We appreciate it.
No worries.
Jeannie, thank you for that question. And I think what I heard you asking is there any risk if somebody got a flu shot, let's say last year, that they may be at increased risk for getting COVID-19 this year? And the answer to that is no. These viruses actually are very, very different, and our immune system recognizes them completely different. That's been one of the major problems about this new coronavirus, is that it's never really circulated in humans before. All of us are not immune unless we've already gotten infected, as we talked about earlier. So right now, for example, in the state of Tennessee, there's nearly 7 million people living in the state. We know that about 40,000 people have gotten infected, which is a very, very small fraction of the state of people who have never seen this at all. Many people globally and in the United States have immunity to influenza. They've gotten flu shots, and that immunity to influenza seems not to play any role in either protecting against COVID-19 or making it worse. And so what seems to be the case in these areas that you discussed is really a matter of virus transmission. When we have people near each other and in range of each other's breath, that virus can absolutely sweep through those populations. And that's particularly true if we can't create distance, if people are symptomatic and spreading a lot of virus and we're not wearing masks, for example. And so you could imagine that a virus that spreads easily, even in the absence of symptoms, through our breath is much more likely to cause an outbreak in a facility where people are really highly densely populated, compared to in a neighborhood where there's one family in this house and one family in that house, or one family in this apartment and another in another. So I think the explanation for why we see hot spots in these communal facilities is exactly because they are communal, and there are lots of people in them that are able to transmit among each other, and that it's independent. It has nothing to do with their previous episodes of the flu or previous flu shots. But that's a really important question that you asked, and I think as we head towards flu season, we're a bit worried about what's going to happen when we start to see both the flu and potentially also COVID-19 in the same populations, as we talked about before. So thank you for asking.
All right, we're going to take another short break, and we'll be right back with more Open Line and your phone calls. Give us a call if you have any questions or concerns about COVID-19, 615-737-PLUS. We'll be right back.